In this video, we'll be talking about hypovolemic shock. Breaking down the word, hypo is for low, vol is for volume, and emic is for blood. With this, we can deduce that hypovolemic shock is a result of low fluid volume in the blood, and specifically in the intravascular system. There are two types depending on the cause of fluid loss. The first one being absolute. This is when there's fluid loss and fluid leaves the body. It can be due to vomiting, diarrhea, or massive bleeding from injury or even surgery. The second one is relative. This is when fluid or blood is leaking inside the body. It can occur with internal bleeding from, let's say, long bone fractures. And for pathophysiology, so when blood is depleted from the body, there's low blood volume circulating and only a small amount returns to the heart to be pumped. This is known as low venous return, consequently low stroke volume and low cardiac output. In addition, decreased amount of blood flowing to our organs and tissue, specifically the cells, will cause the cells to be deprived of oxygen, and there's going to be decreased tissue perfusion. There are four stages depending on amount of fluid loss. First stage, a person loses between 500 and 750 of fluid volume. The body is able to compensate, so they'll mostly be asymptomatic with maybe mild weakness and appear pale. This is known as the compensation stage. Stage 2, a person loses between 750 and 1500 ml. Cardiac output is really low, and the body puts into place other mechanisms to help compensate. So we'll see increased heart rate due to catecholamines, for example, decreased blood pressure, decreased mental status, and this is known as the overcompensation stage. Stage 3 is when a person loses between 1500 and 2000 ml. The body is still trying to compensate, however, we'll see signs of tachycardia, severe hypotension, loss of consciousness as the brain is not being perfused, decreased urinary output, and this is known as the failing compensation stage. Now, last but not least is stage 4. This is when an individual loses greater than 2000 ml. There's going to be major tachycardia, severe hypotension, decreased respiratory rate, and loss of consciousness, and they might even fall into a coma. This is known as failed compensation. And now, if hypovolemic shock is not treated, there's going to be complications that include renal failure, respiratory failure, and death is also imminent. And for diagnostic tests, so what we'd expect is for a complete blood count to be done so that we can check the levels of hematocrit, hemoglobin, and both will have decreased. We're also able to see increased lactate levels as the cells move from aerobic to anaerobic. There's going to be a drop in electrolyte levels and decreased oxygen saturation. On the screen you can see compare normal and abnormal values. The other test that might be done would be an ECG or chest x-ray. Now for the nursing intervention following the APIE approach for assessment, so we'll be checking for our ABCs. Other tests might be done, as I've mentioned, lab work or imaging tests. Moving on to the planning. So the planning or the goal for the treatment would be to prevent any further loss or replace the fluid that might have been lost so that we can increase the venous return, stroke volume, and cardiac output. So the doctor would be the one in charge of ordering the fluids or any other treatment that's to be administered. As nurses would be administering the medication. For one, we would need IV access so that we can provide the fluids, and the fluids to be used will depend on the amount and the type of fluid lost. Examples include crystalloids such as normal saline or lactated ringers. Other fluids, there's colloids including albumin. The doctor might order blood or blood products containing packed red blood cells, platelets, or fresh frozen plasma. The other therapy would be oxygen therapy. So this includes just placing the patient on oxygen or even sometimes mechanical ventilation or intubation as per the doctor's orders. And lastly, for evaluation, we'll just continue monitoring the patient for adequate perfusion and monitor the Foley catheter for urine output, and just ensure that the signs and symptoms are improving.